Good morning, and thank you for joining the Partners Group webinar series today entitled Employee Benefits Legislative Update, What Northwest Employers Need to Know. As we all know, there was a lot of potentially really big legislation on the horizon for 2017. And while none of that passed, we were on the edges of our seats, ready to launch a webinar at any moment, telling our employer clients exactly what they needed to know and do in the event that major legislation came in and actually repealed the Affordable Care Act. Well, we're a few months into 2018. We know that there wasn't quite enough appetite for those big sweeping changes, but that doesn't mean that there's nothing to talk about. And so we thought, we all got together and said, you know what, we're getting requests from our clients and people in the community for more information about the small things that did happen, and some not so small, specifically in Washington State, which we'll talk about. So we went ahead and pulled together all of the bits and pieces of legislation that did make changes for employers. But because there isn't any one single piece of legislation that we're going to be focused on for this webinar, think of this session as more of a trip through the information buffet line. You'll get a small portion of a lot of different topics. And just know that if there is a topic that you're interested in learning more about, all you have to do at any time is reach out to one of your TPG team members, and they can provide you all of the information you need on whatever area you're interested in or have concerns about. So today is really a very high-level summary of a lot of different moving parts in terms of both federal legislation and what's happening locally here in the Northwest, where we have offices in Oregon, Washington, and Montana. Now, I looked at the webinar attendee registration list, saw lots of familiar names and businesses, so we're so glad you're all with us this morning. Only a few of you were on our October webinar. And so for the few of you who did attend both October and you're listening today, there is a few things that may feel like it's a repeat, but we're actually updating that information. And so it will be maybe a review in some areas, but most of the information we're covering today is new. So a few housekeeping items before we get started. All attendees are on listen-only mode. We have a couple hundred attendees registered for today's webinar. And so with that large of a group, we aren't able to take questions live. I would encourage you, though, if you're familiar with how to use the GoToWebinar technology over on the right-hand side of your screen, there's a box for questions. When you type into that questions box, that records all of your questions for us to go back to later and follow up with you. So please, even though we're not going to be able to take questions live, do use that question box to record any questions you've got. And then at the end, there's also an opportunity for you to give us feedback on this webinar, how helpful it was, maybe some other things that you may be interested in, and also ask for some follow-up or some additional details on things that you hear this morning. So, a quick introduction of myself. My name's Sarah Friend, and it's my pleasure to present to you this morning. While I frequently host these types of educational webinars, I am just one of a very large group of subject matter experts when it comes to employee benefits here at the Partners Group. And any one of our team members is ready to help you solve a wide variety of challenges and build business strategies for your organization's future. Like most of our employer services team here at TPG, I've been in this business for more than 20 years. And I'm one of those crazy people who actually like legislation, and I'm really interested in today's topic. So I hope you'll find this hour valuable. Just a very quick introduction for those of you who don't know the Partners Group well. We are a financial and insurance services firm serving businesses, employers, individuals, and families. Our largest division is dedicated to serving employers, and we have grown to now become the largest employee benefits independent employee benefits firm in the Northwest, with nearly 150 employees serving our clients from these 5 major locations. So Bellevue, Washington, up north. I'm presenting from our Lake Oswego office. We have our headquarters in Portland, and then of course Bend, Oregon. We have a team in Central Oregon, and then our team in Bozeman, Montana. Our Employer Services Division offers 4 core areas of service, including employee benefits, which is really the core topic today. But in addition to employee benefits, we also offer healthcare intelligence, so data analytics, health and productivity, which includes advanced wellness consulting and also total absence management consulting, and finally, group retirement plan consulting. So with introductions out of the way, let's dive right into our agenda. Here are the items that we're going to be covering in our hour together. First, I'll cover federal updates, and then we're going to talk primarily about what is happening with the ACA. So we'll talk about it in 2 kind of buckets. We'll talk about first, what are the changes that impact employers? And then second, we'll talk about what are the changes that are impacting the individual marketplace and why should employers care about what's happening in the individual marketplace. So we'll get to both of those. And then we'll also talk about the impact of the new tax plan on employee benefits, the new rule, the EEOC wellness rule updates, and then we'll talk about some state-specific legislative updates. So first, let's start with federal updates and what is going on in Washington, D.C. Probably many of us ask ourselves that question pretty frequently. But first, earlier this month, just a few weeks ago, a few of our team members traveled to Washington, D.C. to find out what was going on. And it was really our primary purpose to carry a few key messages to legislators with us. It was a really interesting trip because typically when you go to Washington, D.C., you have meetings or appointments set with legislators, and those aren't actually the people you meet with. You meet generally with a staffer, somebody in their office, and you just cross your fingers that your messages are getting relayed and getting through to the right people. Well, the week we were there, it was the week of the budget crisis, lots of votes that week. And so everybody was in town. And so we were able to take important key messages from our employer clients directly to legislators. Our key messages to DC included protecting the tax deduction of employer-sponsored insurance for employers and for the families who count on employer-sponsored health insurance, a request to simplify administration for all of our benefit administrators out there who are just drowning in compliance and regulations, to adopt policies that address the actual price of health services, and finally, to stabilize the individual marketplace, because that is critical to ensuring we maintain a strong employer market. A couple of pictures. I know this picture of me and Nancy Pelosi may be polarizing to some, but how can you resist not getting a selfie with Nancy Pelosi? And then to the right, of course, Cory Booker, we were able to hear from him, who by many accounts is expected to be one of the front runners in the 2020 presidential election on the Democratic side. And then a couple of the sites from DC. So what did we hear when we were back there? What is going on and what is making headlines legislatively at the national level? Well, again, when I opened up this webinar, the attention has really turned from healthcare, massive sweeping healthcare legislation, to other big headlines like tax reform, DACA, and of course, in the most recent few weeks, gun control. And so healthcare has kind of taken a back seat. It was a headline. It was on the front page for several months, and now it's on the back burner, but that doesn't mean there isn't activity. So what we are seeing is, instead of big, massive, sweeping changes, we're seeing small changes kind of attacking bits and pieces of the Affordable Care Act. And so we'll talk about those in a minute. But again, so how does this impact the employer-sponsored plans if the administration is really focused on the individual marketplace? Well, if the individual marketplace implodes or goes away, or we continue to see this really, high spike in premium increases, that will threaten to increase the rate of uninsured. And just because somebody is uninsured doesn't mean that their healthcare costs go away. It means that those healthcare costs get shifted to the employer market, and the employer costs, whether you're a large self-funded group or you're a fully insured small group health plan, your costs go up when there's a higher rate of uninsureds in our country. So let's dive right in to really Affordable Care Act updates, because that is the major topic of any changes at the federal level. So I'm going to break it into two types of updates. I'm going to first talk about actions that relate directly to employers. Most of the people on this call are primarily focused on how the Affordable Care Act changes are impacting their businesses. We've got a lot of HR professionals on the line, CFOs, CEOs, benefit administrators. So the good news for you is that there hasn't been huge changes, which is quite a relief after so many years of feeling like you had to spend hours every week on webinars just to catch up on what you were supposed to do to administer these programs. So I'm going to start, though, with not a change, but what happened at the end of 2017 regarding shared responsibility payment and the letters that went out detailing employer fines related to 2015 activity. Then I'll talk about employer reporting, and finally the vote just last month on another delay of the Cadillac tax. So first, shared responsibility payment. I don't think anything quite gets your attention like a letter from the IRS addressed to your finance department stating that your company owes millions of dollars in ACA penalties. That was quite a shock to many businesses who started receiving these shared responsibility payment letters, or IRS demand letters, beginning in November of last year. The letters were mailed for 2015 penalties. So there was quite a lag, based on tax filings and trying to reconcile between who got a subsidy in the individual marketplace, who was then offered or not offered affordable employer-sponsored health insurance. So it took quite a while to discern who might have triggered a penalty for their employers. Well, IRS letters started going out late last year, and what triggered the letter was if you as an organization, and some people on the line may have received a copy of one of these letters, if one of your Affordable Care Act or ACA full-time employees received a federal subsidy on a state exchange or a federal exchange, then that would trigger a letter to you as the employer. Along with that letter, there was a description and an assessment of how much you owed based on the months that you failed to offer affordable minimum value coverage to this full-time employee. Well, employers were then asked to respond to the letter by the stated deadline, and generally that was 30 days to investigate, see if you agreed with the assessment, and then reply back to the IRS. Well, you can imagine the shock to some employers who felt that they had been doing everything correctly, that they had, done the reporting correctly, they had made the offer according to the law, to all of a sudden get this letter with huge penalties and then have to be able to respond, either agreeing or disagreeing with that assessment within 30 days. Again, it put some employers in a really tricky, unexpected place of confusion, record pulling, assessments at the very end of the year. What you can't do, though, is ignore the letter. So you never want to ignore a demand letter from the IRS. That's not a good plan. And so if you do receive or did receive this letter and you've not yet taken action on it, please reach out to a team member at the Partners Group so we can help you. There is controversy about these subsidy letters because employers who received the letters, many of them were quite shocked because one of the premises of the employer mandate was that if you had any of your employees going and getting subsidized health care on the exchanges, knowing that might trigger a penalty for your organization, the exchange, whether that was state-based or federal-based, the federal marketplace, was supposed to notify you as the employer kind of all along the way to say, hey, Sally, we see Sally as an employee of your organization. She is now, applied for and has been granted premium subsidies. What was not happening, according to many of the employers who received these letters, is that both the federal marketplace nor state exchanges were actually sending kind of these along the way warnings. And so there wasn't an opportunity for employers to take corrective action along the way. So I think this is a really, I think these will face core challenges for sure, and we'll see where this one goes. But I do know these are not unicorn letters. They exist. We saw several from our clients who had received them and were in a position of having to respond, which they did. But know that there are penalties associated with not responding, and so make sure that you do take action. Next, employer reporting, everyone's very favorite subject. The good news is that for 2018, there were it's reporting due in 2018. It's for the 2017 calendar year. There were very minimal changes to the 1094 and 1095 forms. And so while I know it's an administrative burden, and I know many employers just beg us to say, when will this end? Can we please stop? When can we stop having to do reporting? At least hopefully the systems you put in place the prior year didn't have to be changed significantly for this year. It is this week that forms are due out to all of your employees who were covered in the 2017 plan year. And then the far right box, the final update on employer reporting is, unfortunately, at this time, we don't see anything immediately on the horizon that is going to change or eliminate the reporting requirements of employers. And so employers would be well advised to remain vigilant in your tracking and reporting processes until such time as the rule does change. All right, next, the next update affecting employers is another delay of the Cadillac tax. And so the Cadillac tax had been previously delayed in December of 2015. Congress passed and President Obama signed an initial 2-year delay of the Cadillac tax, pushing it out from 2018 to 2020. The Cadillac tax seems to be the one thing that draws people together in their collective support of wanting to repeal it, and so there was no problem in finding enough support to again delay or push out the Cadillac tax to 2022. So that happened just last month. Congress passed and President Trump signed into law another 2-year delay. And that, of course, if you remember, the Cadillac tax is that 40% excise tax on high-value healthcare plans. And we would expect that we'll probably continue to see this either pushed out or repealed eventually altogether. The challenge with repealing the Cadillac tax is that it's really, on paper, it's what balances out the cost of the Affordable Care Act. And so if you take it out altogether, the math doesn't work for the Affordable Care Act. And so they keep it kind of on the balance sheet, but they just keep delaying it. So that seems to be the strategy with the Cadillac tax. So as you can see, there isn't a ton of direct employer changes to the Affordable Care Act for 2018. What we will be sending out to you, though, I think it's a super helpful tool. The Partners Group, we have an ACA overview. It's a 2018 compliance checklist. So for all of you who are attending the webinar today, along with a copy of the slide deck, we'll also send you a copy of our compliance checklist, just as a good reminder for you to kind of go back through and say, yep, got it. And then you'll be all set. Many of you probably won't need that, but I was just reviewing it this last week as I was preparing for this webinar and was just reminded that, some of these things are just good to have on hand as a quick refresher. So we'll make sure everybody gets that. So let's shift gears from talking about the actions that have impacted the employer marketplace regarding the Affordable Care Act to actions that impact the individual marketplace and how those actions are kind of perpetuating this instability of that market. Before we get there, just a couple of notes about the individual marketplace. A couple statistics here that employer-sponsored insurance, often referred to in our industry as ESI, that's your health plan you get from your place of work. ESI is the most common type of health insurance in the United States. It covers 177 million Americans. That is in comparison to the 20 million Americans who are covered on the individual marketplace. So, people who aren't on Medicaid, Medicare, TRICARE, don't get their insurance from their employers, who buy their insurance on their own. It's a relatively small group of folks. If we were to bundle them in with the people who get their insurance from their place of work, it would be about 10% of that total group. 90% getting coverage through their work, 10% getting coverage through the individual marketplace. The employer marketplace, or ESI, is a stable marketplace. So it has a pretty stable risk in terms of, there's not a lot of adverse selection when an employer offers an employee health plan. Generally, it's offered to everyone equally, and so you've got a good mix of both healthy and sick, young and old, single people versus families. And because of that healthy risk pool and a lot of that, it's been a very mature market for a long time, the costs are pretty stable in that market. And premium increases last year on average in the employer-sponsored insurance market rose 3%. Now compare that to the individual marketplace. This is what's getting all the headlines. So when we see headlines about, 20%, 30%, 40% rate increases, those stories are really talking about this smaller group, this individual marketplace. And average premium increases last year exceeded 20%. Now, the link to this 10% of group getting coverage through the individual marketplace versus the 90% of folks getting coverage through the employer market. How did those things correlate? Again, that strong and stable market for employers is really dependent on a stable individual marketplace, and we aren't there. So this is my best effort on my own. I'm not great at creating these graphs personally, so this is my best attempt. So on the left, you can see patients, right? So you've got a group of individuals who access the healthcare system. That yellow circle in the middle is just meant to represent healthcare utilization, whether that's hospitals, physicians, prescription drugs, whatever that is. That orange box in the middle is healthcare utilization. To the right are the various payers. So 3 primary groups of payers: employer-sponsored insurance, individual insurance, and then public programs like Medicaid, Medicare, TRICARE, etc. So what happens is, in the event that that yellow payer goes away on the right, that only changes the flow of money back to hospitals, physicians, and pharmaceutical companies. That the removal of the yellow doesn't change the healthcare needs of the people on the left. The people on the left are still just as sick as they were. They need just as much healthcare as they needed when they had individual coverage. And they're likely to then, instead of having coverage, they would show up in an emergency room, doctor's office, hospital, for some unreimbursed care. So the hospitals, the orange bucket, or physicians or prescription drug manufacturers, their costs are the same, and they aren't going to be very likely to write those expenses off. And so you see a shift in dollars. Those dollars move from the yellow box up to the employer-sponsored insurance box. And so the expenses for that group just gets higher. Now, how come the money didn't move down to the public box? The money doesn't move in that direction because the federal government controls how much they spend. It's basically regulated. And so there cannot be cost shift to how much they pay doctors and hospitals. It's just the reimbursement rates don't work that way. The cost shift, when you squeeze the balloon, the cost shift goes to employers. So I mean, of course we care because of the good of the public and our country, but there's also a business reason for employers to care about this stable individual marketplace. So just like we talked about 3 changes or actions that related to the employer-sponsored market, I'm going to talk about 3 changes that are affecting the individual marketplace. So the first is the repeal of the individual mandate, which was included or embedded in the tax bill. The second is continued threats to CSR payments, which many people probably don't even realize what those are. So I'm going to talk about what those are, and maybe when you hear it on the news when it comes up, it'll be more relevant. And finally, I'll talk about just this last few weeks, President Trump's new executive order allowing for a broader group of skinny or short-term plans. So let's talk first about the repeal of the individual mandate. So we all call it a repeal of the individual mandate. Many of us do. It's not actually a full repeal of the individual mandate. It is an elimination of the tax penalty. And so individuals who do not carry or cover themselves or their families in 2019. So in 2018, the penalties are still effective, but in 2019, any penalty associated with not carrying minimum essential coverage for you and your family goes down to 0. And so because there is no stick, there is no, there's no bite to it, then essentially the individual mandate goes away. Again, unfortunately, the silver lining to this for employers would be, great, if people don't have to prove insurance anymore, then why do I have to send them forms that they would then include with their tax filing? It has not gone that far. And so the reporting requirement stands, and essentially the individual mandate, they'll still check the box, or there'll still be a place on it on their tax filing. There just won't be any penalty if they answer no. So let's move from the individual mandate. Well, before I move completely off that, so lots of insurance companies who offer coverage in the individual marketplace are worried that if healthy young people aren't incented heavily to buy individual health insurance, that they'll opt not to. And so that will perpetuate this adverse selection of the individual marketplace, where only the sick people who need immediate access to health care, who have chronic conditions and an expected upcoming medical event, those are the only people who would pay to have this type of coverage. And so if you allow the healthy and well to opt out, of course that creates a pool where costs continue to escalate until finally that marketplace is no longer able to sustain itself. So that's the concern of underwriters in this area. Another concern is related to these CSR payments. And so CSR payments, they are, what are they? They're two ways that the Affordable Care Act helps families and individuals afford health insurance in the individual marketplace. One is the one that we talk about most frequently, which is the way that the ACA helps to pay your monthly premiums. So it basically says if you and your family fall below X threshold of income, or a percentage on the chart of the federal poverty level, that your cost for health care for you and your family can't exceed a specific amount. And if it does, then the federal government would help step in and pay any amount over and above that specific threshold. So there is a second layer of assistance that's available to families under the Affordable Care Act. And this second level of assistance is called cost-sharing reductions. And cost-sharing reduction payments are available to any family or individual at or below 250% of the federal poverty level. So this allows for families to get help not only with just their premiums, how much they pay to have their insurance, but it also helps them to cover their out-of-pocket expenses when they do need health care. So it pays for a portion of their deductibles, their co-payments, and their out-of-pocket expenses. These cost-sharing reductions are only available on silver level exchange plans, which is a category or grouping of level of benefits. And nearly 75% of exchange purchasers qualify for CSR payments. So how does the flow of CSR payments work? CSR payments don't go, it's not like a family gets a check in the mail, right, that says, okay, you had a $1,000 deductible, we're going to help you pay for that. The flow of money is that the insurance company is the one that kind of fronts that reduced deductible expense, that reduced out-of-pocket expense for the family that qualifies. And then the government reimburses the insurance companies for these CSR reimbursements or payments. Well, since the beginning, the CSR payments have been very controversial, and they have been in doubt since 2014, when a lawsuit was filed by House Republicans who claimed that the Obama administration was paying the subsidies illegally. Judge Rosemary Collier in Washington agreed and found that Congress had never appropriated the money for cost-sharing subsidies. And so, indeed, without the appropriate appropriations, the administration didn't have the authority to make these payments. The Obama administration appealed the ruling, and it was in the process of that appeal when the administrations changed from Obama to President Trump. The Trump administration has continued to make payments from month to month, although he did at the end of last year, fourth quarter of last year, he signed an executive order basically saying enough is enough, these are illegal payments, so we're going to stop the CSR payments. And so that happened on October 12th. Now, here's a quick summary just so you can get an idea of, again, these federal poverty levels and the incomes that would qualify an individual for these type of cost-sharing reductions. And again, it's that middle column, the 250% poverty level that triggers availability of cost-sharing reimbursements. So we talked about kind of this timeline of when, this long history of CSR uncertainty. And so what's happening is that insurance companies have been left kind of holding the bill ever since October, and they have continued by mandate, especially in Oregon, by mandate of DCBS, that the CSR reductions to families would continue, and we'll kind of figure out how the money is where the money is going to come from to help pay insurance companies back for those CSR payments as we move forward. Well, what's interesting is that these cost increases, so many insurance companies had, when this executive order came down and they said, you better plan on 2018 that you're not going to get these payments from the federal government. Insurance carriers, you're going to have to build this into your premium rates. Well, they'd already filed their premium rates for 2018. So many states allowed insurance companies to go back in and refile their programs in terms of their premium fees. And it resulted in a 7.1% in Oregon, 7.1% increase in individual premiums based on the expectation that CSR payments wouldn't continue for insurance companies in 2018. What's really interesting is that the cost increases, that 7.1% increase to these silver plans, actually increases federal premium subsidies to qualified families. And so the federal government likely will end up absorbing the additional premium increase through that first layer of premium help. Remember, we said, families' maximum monthly premiums are set based on a formula, and the government pays for anything over and above that. Well, if they're already exceeding their limit and the silver plans go up more, it just means their premium subsidy goes up more. And so it's really this interesting kind of cause and effect that the increase in subsidies will, may shift enrollment between some of the metal plans and increase enrollment in and increase federal payments of premium subsidies for silver level plans. So our CSR payments really dead. There continues to be a group, so Senator Alexander and Patty Murray, so this bipartisan team who had reached a deal last year to fund CSRs in exchange for giving states more regulatory flexibility with the new law. Now, there was lots of talk and kind of expectation that the CSR extension would be included in the budget deal, and it hasn't been. And so this CSRs continue to be, a lot of uncertainty around the future of CSR payments. And Senator Alexander and Senator Patty Murray have not given up on this and are continuing to lobby Paul Ryan and Mitch McConnell and others to try and ensure this as a better show of stability for insurance companies moving forward. So insurance companies, of course, all of this elimination of the individual mandate and then the stopping of CSR payments gives insurance underwriters gray hair. So I'm going to come back to the map in a minute. But whenever there is uncertainty around filings, rate filings, subsidies expected and not received, it layers on this conservative approach to underwriting. A few points of margin here, they're going to assume the worst, right? And that conservatism equals higher rates. And that isn't just the individual marketplace that impacts. That, as an underwriter, affects kind of the entire ecosystem, and it has kind of a dark cloud that then lingers over premiums as they're working on their group plans, even if you're self-insured, stop loss. Uncertainty about future losses absolutely does have a spillover effect into all layers of underwriting. And then going back to this map, you can see, Oregon, Washington, Montana, we're pretty good. We've got, at least 3 carriers in almost all counties. In our 3-state region, there's only 2 counties that, had in Washington, really struggled to have a carrier play. And, carriers are really reluctant to dive in when there's all these layers of uncertainty around the individual marketplace. So now let's shift gears and let's talk about a couple other non-ACA related topics. So first we'll talk about the potential impact of the new tax plan on employee benefits. Actually, not the potential impact. We know what it is. So let's first start with that. It's the Tax Cuts and Jobs Act that was passed in December. And this bill, of course, lowers the corporate tax rate beginning in 2018, and it creates a new tax deduction for small business. It allows expensing on capital investments, but it's specifically for employee benefits. It does a couple of things that I'm sure many of you are already aware of. First, there is an elimination of the deduction for expenses associated with qualified transportation fringe benefit programs. So basically, if an employer is, buying bus passes or making contributions to any sort of tax preferred program for parking expenses or commuter expense reimbursement programs, those can no longer be deducted as a business expense. Now, the employees who are putting tax-free money into those commuter expense reimbursement programs, those still get that tax-favored benefit. It's just the employer contribution that is no longer going to be able to be deducted. Employees also cannot exclude bicycle commuting reimbursements from their gross income. And so if that was a part of the employee benefits program up until the end of 2017, that, of course, can still be a part of your benefit program, but it will be taxable as income to the employees who are benefiting from that. 2 other changes that impact employee benefits related to the tax law is that moving expense reimbursements are not deductible for employers and cannot be excluded from employees' gross income. So that if you've got a big moving package, if you're moving people around the country, that does become taxable to your employees in 2018. The Act creates a new temporary tax credit for employers that provide paid family and medical leave to their employees as well. So we just, as we get into state updates in a minute, we see so much happening around leave laws and moving or shifting towards paid leave. This is a really interesting topic. And again, I'm going to give you our contact information for our subject matter experts at the end. If you're interested in learning more about this temporary tax credit, it's, I think, a 2-year program. I would encourage you to reach out to our leave experts here at the Partners Group for more information. All right, a quick minute on EEOC final rules on wellness plans. So again, this is just going down the buffet line. So this is going to be very high-level information. And this, I know many of our employers who we work with at the Partners Group, including TPG, we have a very robust wellness program for our own employees and families. And we're always, careful when we're setting these programs up that we're following all of the various regulations that have any sort of oversight on wellness programs. So ADA, HIPAA, EEOC, just to name a few. So in 2016, doesn't seem like that long ago, the EEOC issued final rules that became effective last year, January 1, 2017. And those rules described how ADA and GINA apply to employer wellness programs. And so these were employer wellness programs that, a common one would be, asking your employee to go in for a physical, or asking an employee to complete a health risk assessment that had any sort of family history questions included in it, because that, of course, would be covered under GINA. Under the EEOC rules, employers could offer these wellness incentives for these types of, activities, as long as the program was considered voluntary. And the way they deemed voluntary is the EEOC said, well, we'll set the threshold for incentives that it can't exceed 30% of the value of self-only premium for the health plan. So let's say, and the self-only cost is $500. Then in this case, you couldn't create an incentive or a penalty for an individual to participate or not participate in the wellness program that exceeded $150. So that's 30% of the $500, okay? AARP challenged those EEOC rules, stating that the 30% was arbitrary, and how did they come up with that 30%? And they had members who were really struggling to afford that maybe disincentive or penalty for not participating. So AARP said, for somebody who is struggling to afford that, that makes it not really voluntary. It makes it not voluntary in nature, excuse me. So a court ruled that the EEOC should take some time, go back to the drawing board, right, and really reconsider through their administrative rulemaking process if the 30% should stand. And the AARP continued to push. The EEOC responded and said, we'll take that under advisement. It'll take us about 2 years to do that. And so the AARP said, no, that is not good enough. We want faster action. And so as a result, the AARP continued to push, and the court responded by agreeing with AARP and vacating the rules effective January 1, 2019. And the reason that they didn't do it immediately is because they want to give they want to give, I think, the EEOC a little bit of time to, act faster and reconsider the rulemaking process. And also, and maybe more importantly, to give employers like all of you and ourselves time to really consider what this means to the design of our own wellness programs and what we might need to do to make sure that we're in compliance for 2019. All right, let's shift in our last few minutes together. Let me give you a quick overview on what's happening more locally in terms of legislative updates. So we're going to start with Oregon, then we'll move to Washington, and there's really nothing going on in Montana, and so we won't have too much of a state update for Montana, so we'll just focus on Oregon and Washington. Let's start with Oregon. Of course, our big news was Measure 101. With lots of controversy and debate. It was the first tax of its kind to be passed by a popular vote in our state, actually any state. And so here's what that was all about, just as a reminder. The Oregon legislature passed a $550 million healthcare tax plan and said that this was necessary in order to fund a pretty major budget gap for healthcare through the Oregon Health Authority, and specifically to fund Medicaid. And it included a tax increase on hospitals and a new 1.5% premium tax on any insured employer-sponsored health programs. Lawmakers attempting to close that $1.4 billion shortfall, maintained that this tax was absolutely critical in ensuring that people didn't lose their health insurance coverage through Medicaid if this budget crisis wasn't kind of shored up by this new tax. Opponents said, hey, wait a minute, one, we're not quite sure we agree with you that the budget shortfall is as big as you say. And two, gosh, this doesn't seem like a very fair means of assessing a tax equally, because the only people to get the 1.5% premium load are employers who buy insured products. And so that generally is small employers. Large employers tend to self-fund, and of course, under ERISA, there is no opportunity for states to assess taxes through their health plans if there's an ERISA self-funded plan. And so Republicans, of course, said, we're not accepting this, even though it passed the state legislature, and a few local opponents got a petition together and got enough votes to get in on the January ballot. And of course, we know that the results of the ballot measure was that Oregonians passed the measure. It had wide support of physicians, hospitals, insurance companies, who I think were all, nervous about that potential, enrollment drop-off for Medicaid. I had an opportunity a few weeks ago to moderate a CEO roundtable, and we talked about this. And I asked them specifically about how, did they think this was the right long-term solution to funding Medicaid, to tax insurance plans. And I think, the majority has said, no, not long-term. There has to be a better way. But for the short term, it was the only way, the only path forward that they could really see to make sure that we weren't in crisis mode in 2018. So it will be very interesting to see. This is not a problem that goes away with Measure 101 funding Medicaid, especially when federal premium or federal Medicaid subsidies go away. This will become a bigger and bigger issue for Oregon. Let's shift gears and talk about the big deal in Washington. So the big news in Washington is all about paid leave. And so for Washington employers, if I know we have a large group of Washington employers on the line today, of course, you're just getting used to the new paid sick leave law that went into effect just last month, January of 2018. And what is big news now is that Washington has become the 5th state in our country to pass a guaranteed paid family leave law. What's interesting for Washington, not only are they kind of at the forefront of pioneers in this area in terms of states, but they're also very generous in their program. And so where other states are limiting paid leave to 6 or 8 weeks, Washington's plan, which goes into effect January 1 of 2020, provides between 12 and 16 weeks, depending on the circumstances of that leave. The costs under this program will be shared by both the employee, who will pick up 63% of the cost. Basically, it's going to be a state-run program, and employers will pick up 37% of the cost. Now, what's tricky about this program is how it is complex, because it, of course, overlaps with FEMLA and other, federal leave requirements. If you have, most employers don't just have employees in Washington, they have employees in multiple states. And so, this impacts Washington employees. So what do you do with the employees in your other states? Or what if you're headquartered in Oregon and you have employees in Washington, a small group? What do you have to do to participate in the program? How does it offset with your short-term or long-term disability programs or paid time off programs or vacation programs? All of those are complex questions that really will require assessment of your current plan and planning to ensure that you are ready to go and compliant by 2020 to avoid penalties. So we're just at the hour. We've got a few minutes left. So before I leave you, I want to make sure that you've got the right resources to get more information as you need it. So again, we started off talking about our employer services group. We're a large group of subject matter experts. We've got a big team that specializes in employee benefits. Many of you work with our team. But then we also have specialized experts in particular areas of expertise. So I'm going to come back to this in a minute, our next webinar. I want to introduce you to some of our experts first. So this is your TAM team. TAM stands for Total Absence Management. If you're one of those Washington employers who is freaking out a little bit about what in the world you need to do to get ready for the new paid leave law, or maybe you're not in Washington and you're just already struggling in Oregon with OFLA and FEMLA and multi-state compliance, I would encourage you to reach out to our TAM team. We've got 2 absence management consultants, Patty Borst and Jean Shearer, and then a rock star account executive in Brycey Rapoon. So this group they're so passionate about leave laws and can really be an asset to you as you're kind of wading through these new regulations. We talked about the EEOC rule and what does vacating that rule mean to employers who sponsor wellness programs. If you want to learn more, Alexa Galuzzo, who's our managing consultant of our of Partner Well, which is our advanced wellness consulting area, she is amazing, and she is really connected. She actually just was a part of the Worksite Wellness Group. Well, I think some of you may have participated in that webinar where they did a whole hour on what, compliance issues related to wellness programs. So if you're concerned about this area and want to learn more, please reach out to your employee benefits team. And if they need to get Alexa involved, she is an absolute resource to our organization. That really makes us all better in this area. Finally, in employer services, we didn't talk about retirement plan consulting today, but I know Nicole Pond and her group have some upcoming educational opportunities themselves. This is Nicole. She's the managing consultant of our retirement plan consulting division. So if you don't already work with Nicole on your 401k plan, and if you have questions about that, I would encourage you to reach out to Nicole. So that's just some of our subject matter experts on things that we touched on today. Here's the rest of our year in terms of our webinar schedule. So we work hard to bring you information that's up to date and relevant. So you can see on here our next planned webinar where we've got the topic already laid out. We've got an FMLA update that's going to be presented by that PAM team I just introduced you to. That's going to happen in April. In May, we're going to be rolling out a technology webinar, so benefits administration solutions. In June, we're reserving that space for a relevant topic or kind of a hot topic as we get into the summer. July, retirement plan consulting. August, total absence management. September, wellness. October, another ACA wellness update to get you ready for 2019. And finally, another total absence management webinar planned for November. So lots of opportunities for you and your team to join us again for more information. Again, as we sign off, I want to call your attention to there's going to be a survey question at the end of the webinar. I would ask your feedback. It's so helpful for us as we plan these webinars. So I would really appreciate you completing that, telling us what you value most in information, how we can do better for you. And then finally, there is an opportunity for you that if you do want more information, you can either email me, you can see my email address on this final slide, or just respond to that form and one of our team members will get right back to you. So thanks so much for spending an hour with us this morning. We hope it's been a value to you, and we appreciate your time and attendance and hope you have a wonderful afternoon. Thanks so much.